So this is the basic heart examination, if you will. The historical elements in the chart are important to review, any history of syncope or congenital heart disease, those things are all important, but for the most part you're dealing with a very healthy young audience. The heart sound examination is probably the most important thing. Most of these athletes are relatively fit and they're not going to have historical things you need to worry about. But in terms of the heart examination, I like to make sure I have a nice quiet room with a lot of background ambient noise. You want a good quality stethoscope. There are some lower quality stethoscopes that aren't going to work as well, but a good quality Littman or something like that will work very well. Either on a t-shirt or a tank top or without a shirt, especially if it's males, get a really good exam. A couple tips to help with the exam: have them lean forward a little bit. That brings the heart closer to the chest wall. And I like to kind of start down by the apex. You want to hear the good heart sounds, S1 and S2, make sure they don't have a murmur. And then you can move that around further down the apex. And then you can work your way back around the apex and then up along the sternal border. And the most important thing to listen for is any type of murmur. If you don't know what a murmur sounds like, you probably do, but there's lots of great YouTube videos with audio and video for examining the heart, and in particular, what's a heart murmur. You will occasionally pick up a murmur, and if you can hear it, it's probably something that needs to be evaluated. The other thing is an arrhythmia. For the most part, the heart rate should be symmetric with very little variation. There is a little variation as people take a deep breath from time to time, but for the most part, there shouldn't be much variation in the heart rate. So that's the simple heart examination. The pulmonary examination, once again, most of these are going to be very healthy kids. If they've got a history of asthma, that may be more important. But the things that we're really focusing on is good, clear, symmetric breath sounds on both sides and the absence of wheezing. You can certainly listen to the front for breath sounds. I think the front works fine, especially on the right, because the heart's not in the way. And you can also do the same on the left, but you have to get around the side of the heart. But I find that a very efficient exam is to listen on the back, start at the lower lung fields. And this is where you may have the patient slowly breathe in and out, but with the mouth open somewhat, because that gives a deeper breath sound for you. And move around, make sure you hear good symmetric breath sounds. And you shouldn't hear any wheezes. Once again, you can listen to wheezes on any YouTube website. And usually listening for a couple respirations in and out at 3 or 4 different sites on the back, or 5 or 6 on the back, and 1 or 2 on the front is more than adequate.